Beth, the Alaska Health Project South Sudan is headquartered here in Anchorage. Its founders say they have established medical clinics, improved agricultural practices, and built 56 wells in South Sudan since 2008. With the conflict in Khartoum, the group says thousands of refugees are already fleeing into South Sudan, where the Alaska Health Project South Sudan is operating. Dr. Jack Hickel is the board president of the Alaska Health Project South Sudan, a nonprofit that has been working to strengthen impoverished communities by helping provide clean drinking water, improving agriculture, and establishing medical clinics.
To fight starvation and malnutrition, it's an amazing opportunity to do good. We find ourselves in the right place at the right time. There's been wars, we worked right through it.
Hickel says he hopes the recent conflict in Khartoum doesn't lead to another civil war.
That country, since 1955, has gone through 3 civil wars with very few years in between, and it's just devastated that country.
He and Executive Director Todd Hardesty say they're trying to turn tragedy into an opportunity to help.
If what we can do to help is collectively bring clean water to refugees, that's going to help, and that's actually going to lift us up to a point, lift the world up to a point that is better than it was before we tried to help it.
There have already been thousands of people crossing into South Sudan daily, and Hickel anticipates the number of refugees growing in the region.
This is like one more domino that is fallen, that is pushing the entire region to having a humanitarian crisis beyond anything that we could have considered 2 weeks ago.
And more people in need means more work overseas with big goals to reach.
We're going to do some very intense fundraising to drill more wells. Each well costs about $15,000 to put in. Even in the flood season where we're at now, we elevate those wells on platforms so the wells are functional year-round, even in flooded waters.
The men say they're going to install new wells based on need and where refugees are. They hope to have 40 more wells put in by 2025 and want to establish 1,000 more family farms in South Sudan. By the way, this nonprofit was originally founded in 2008 and called the Alaska Sudan Medical Project. Now the group continues its same work as the Alaska Health Project South Sudan.